pass laws and tell the executive branch what we want done. We make the policy, governor signs the bill, and the Department of Corrections or the administration ignores it. So we've needed a facility study that was in an appropriations bill in 2021. Still don't have it. And so we're supposed to ignore, that was the law in an appropriations bill. Coming up with a program statement for a halfway back house was the law in an appropriations bill. And they just get ignored. And they come down to the Judiciary Committee when we ask questions and say, well, I don't know, we really didn't know what you were after. That's nonsense. I've been in meetings where it's been crystal clear. And what we need for a facility study may tell us that this prison that's been proposed is nonsense. But until we have the study, I can give you my judgment. And there's plenty of people that can say that facility study needs to be done before we spend a nickel on additional space. And in my judgment, the reform should happen, the facility study should happen, and the classification study should happen, because in my experience, that's being gamed to make it look like we need more higher security cells than we actually do. And colleagues, you know this from sitting here, the higher the security level, the more expensive that cell is going to be. Community corrections, cheapest thing to run. High security, the most expensive. All those doors, the fancy ways they move, and the way we have to staff them, the most expensive. Making sure that we custom fit the facility to the population that we are going to serve is critical. Bob Houston, we had a group, and I know Senator Pansy Brooks and Senator McKinney was on it, along with 3 or 4 members of Appropriations Committee. We had a number of phone calls with Bob Houston, the former director, and he will tell you, you don't build until you have a facility study. And that we thought was going to be done before the beginning of the 2022 session. And it's still not done. It's still not done. Not having that done is intentional, in my experience. And the legislature next year needs to understand that they can decide whether they're going to let the administration get away with not doing what we put into law and directed them to do, because that's happening. And it's our role as the legislative branch to provide oversight. And when we turn the other way, or we don't want to embarrass the administration and don't engage in oversight, then they don't respect the legislative branch and they can ignore what we put into law, which is what's happening. That's the most concerning thing about the Department of Corrections in my experience over the last 4 years since I've been back.
Thank you, Senator Lathrop. Do you think that the Department of Corrections and our community, and this is kind of a broad statement, or a broad question, I should say, so you can take it where you want, but do you think that the Department of Corrections and our community and our state as a whole is safer than when the incident with Nico Jenkins occurred years ago? Do you think we are in a better place?
You could look at statistics for crime. You could look at, is criminal activity up? That may be part of the answer. I think the thing that's most concerning to me is that when we debated LB 920, what we discussed were statistics and examples of some of the worst and most dangerous people getting flat sentences. This isn't happening to somebody who broke into,
most meaningful non-consensus item in terms of, you've said that there were several consensus items that wouldn't have moved the dial much. What's the one that would really have moved the dial? Or if there were two, I guess that's fine.
I think the most meaningful and is the one we just talked about. If we have indeterminate sentences, and this would have been available not to the, the guy who committed a first-degree murder, but where we have indeterminate sentences, we need to legislate a gap between the high number and the low number. I think the bill had 50%. The low number needed to be 50% of the high number. What that does is it provides a window of opportunity for parole and an incentive. And when, as you know, you're parole eligible at half of the low number, and you jam out at half of the high number if you keep and retain all your good time. The difference between those two dates is the incentive someone has to parole versus jamming out. They don't really like all the follow-up, right? And being accountable when they get out. But creating that window then provides them with an incentive to get their programming complete, behave, not get any class 1 violations, go before the parole board and be paroled, where they will then have transitional services and then be followed and accountable to somebody. That was the heart and soul of 920. And interestingly, the CJI working group, everybody on there said more people need to be on parole. This was the only way to make it happen. But when the bill is introduced, and that's how it is structured, the opposition began.
Another area that you touched on was the lack of accountability or the lack of follow through from the executive branch or the department on laws that we have passed in the legislature in the past. What do you see as the most effective ways of enforcing that accountability? Is it just?
I think the legislative branch has been complicit in that. As long as there's no accountability or no consequence, and we don't hold hearings with a meaningful investigative committee that looks into these things and requires that people come in and be answerable and answer questions. So in 2015, we said we shall have electronic medical records. That still hasn't happened. Every year we're told they're working on it. For example, when we don't have a facility study, we should have had a facility study at the beginning of this year before we went into the 2022 session so that we could see, is this plan that Director Frakes was walking around with and talking about what we need, or are they building the wrong kind of beds or more beds that are more expensive than the ones we need? The willingness to ignore what we have required in legislation is concerning.
I agree. I've also passed a law that was not followed exactly. So I wonder, what is the recourse that the legislature has to work with a branch of government that will not do what that branch of government is supposed to do?
Well, the answer is you do a special investigative committee that has subpoena power. Because when we did that in 2014, you ended up with LB 605 and a number of efforts, at least, to try to reform the Department of Corrections. By contrast, when you look at what we did with the St. Francis Special Investigative Committee, which basically was bring a few people in, we didn't subpoena anybody. We stripped that out of the resolution, you'll recall. I think that is a toothless tiger, and you don't get to the bottom of things until and unless this body, this branch of government gets serious about engaging in oversight, which includes, in my estimation, special investigative committees with authority to subpoena and place people under oath.
And when you did that, was there enough media coverage or whatever of those proceedings that,
Oh, yeah, there was.
that's
Yeah, there was.
my recollection.
There was plenty of interest and plenty of public interest. And it's not done to embarrass the administration. It's more done to shine a light on the problem and give people the background and the political cover to make the reforms that need to be made.
Thank you, Senator Lathrop.
Yes, Senator Brown.
Thank you, Chair Panton Brooks. Thank you, Senator Lathrop, for bringing this. As a member of the committee for the last 4 years and a citizen of the state, thank you for your 12 years of service. So since 2014, which is the end of your first 2 terms, and you got to sit out and watch the show, and now you're back, now you're leaving. From the discussion with the previous 2 senators, your number 1 priority for change today would probably be the facilities report.
Well,
From the,
my number 1 would be 920, Senator Brandt.
okay.
Okay. But beyond the corrections reforms, if I were to put it in order, I think the reforms need to happen. I think we need to have a classification study so that the facility study accurately reflects what our population, how we classify our population. Are we doing it accurately, or are we classifying, as I get letters, you probably do too, from people that are down at Tecumseh, and they say, I haven't heard anybody and I've been in here for 16 years. I can't get out of this place because I'm a long-termer. Are we classifying people because that's where we got a bed, right? So that's sort of the point of the classification study. Then a facility study will tell us what our needs are, because facility studies generally will have a projection of the population in each classification. And then you look at the inventory, and then it'll tell you what your needs are for beds.
But is the issue with the studies that we have asked Department of Corrections to do the study, or because we have not asked a third party?
No, we directed them to update the Dewberry study that was done in 2014. So we don't want a report from the Department of Corrections on a facility study, because we know we want an outside group that has expertise to come in, and that's what they were directed to do.
Okay. Another issue you've been a real champion of is programming. And, you sit here and you listen to a lot of this over the last 4 years. And I'm all about incentives and how we incentivize people to take programming. And it sounds like you're saying that the biggest incentive out there would be an early parole date. Would that be correct?
Having a gap between your parole eligibility and your mandatory discharge date, that's where the incentive is. The opportunity to be released on parole sooner.
Okay. Final question. We have 3 branches of government. This seems to come down between the legislature and the administration. Why does the court not intervene with such an overcrowding situation in the state of Nebraska? If we're at 150% or wherever we're at, why is the court sitting on the sidelines?
So let me be really, really clear about the judiciary. The judiciary can't engage in policy. And Senator Geist was on the CJI. We had 3 members of the court, the Chief Justice, a district court judge, and a county court judge. They were there basically to say, hang on, that's not going to work. They did not and cannot, under their ethics, offer opinions on policy. So you won't see the Chief Justice come down here and say, you need to do 920. He can't. That violates their ethics. As far as the courts intervening, that requires a lawsuit. The ACLU did sue the Department of Corrections in federal court over the conditions of confinement. Interestingly, the department defended the penitentiary, and then that case got dismissed. And after it was dismissed, then we got an engineering report last year that said, the place is falling apart and we need to replace it because it has so many deficiencies. But It would require somebody like the ACLU or an inmate. The ACLU files it on behalf of an inmate suing the state over the conditions of confinement.
All right, thank you.
Yes, Senator Geist.
I guess I can't not comment. I didn't realize we were just going to rehash 920 today, but since we are, you do understand that part of the pushback is a philosophical disagreement with not taking 920 as a whole. What I mean by that is your division of 920, which was penalty and sentence reduction, separated from reforms and community, beefing up community, parole, probation, programming, is simply allowing a reduction and allowing people to get out early without following up and financially beefing up their support system, which is the philosophical disagreement that came down between what the pushback of 920 was. And I just want to not let that go, because we agree on programming. What we don't agree on is simply the reduction of sentence and penalties without the programming piece attached to it.
So I'll respond to that,
Okay.
if I may. So when we were debating 920, there were two central arguments made by the opposition. One was that we're letting people out early. And Senator Geist, what I tried to explain, and maybe this wasn't clear, is that no one gets parole or leaves the Department of Corrections before their mandatory discharge date unless and until the parole board, by the way, appointed by the governor, grants them parole. We're not simply opening the gates like the TV ads say and letting people out early. They had to, let me finish please, they had to be paroled by the parole board. That's not automatic. They have to appear and demonstrate that they are suitable candidates for parole. And then they have to be approved by the parole board, which for the last 20 years have been appointed by Republican governors. The other argument that was made is that we'll work on it during the interim. 920 isn't ready for prime time. We'll work on it in the interim. And what I understand is nothing has been done. There was going to be a meeting between you and Senator McKinney and others and the boots on the ground to get something done. And to my knowledge, none of that's happened. So that's where I got a problem.
Senator, I am working on programming. I am working on what we can do to beef up our community programming at this point. That doesn't involve you, but
Or apparently Senator McKinney.
no, I have not met with Senator McKinney yet.
Okay, because
But
I
that
think
does
that was
not
one
mean-
of the things that we heard when we were debating.
That doesn't
920.
mean that that's not going to happen.
Okay,
Thank you.
sure.
Thank you for bringing all this, and, you know, I feel like it's just Groundhog Day all over again. Senator Lathrop, when we first came in 8 years ago, 605 was being passed. I brought the 1/3 rule, as you know, at that point, and to separate and allow people to get that programming. We later decided to go to a 1/2 rule so that they get the programming they need before they are released. And it's just the continual same thing. Previous former chair, Senator Seiler, appointed Senator Ebke and me to look at programming and bring forward all the ideas that can come forward on programming. Again, we just met barrier after barrier. We just talked great stories about helping programming. And I've talked continually about the vicious cycle. The overcrowding leads to a lack of staffing. A lack of staffing leads to a lack of programming because there's not enough people to take the people to the programming or take them out of their cells. And then we have, with that lack of programming, we have the ending up with people jamming out. And with that jamming out, we have recidivism. And so then again, that leads again to overcrowding. It's the continual vicious circle. Nothing has changed since 605, 920 wasn't accepted. We are doing nothing, unlike bright red Texas, where they're closing prisons. We are continually talking about building prisons, not helping our taxpayers, not working to make a difference. What I'm interested in is why you think we ignored the law, because Senator Brandt touched on this, the law regarding overcrowding of prisons at 156%, I believe, and they were supposed to start having emergency procedures. It was basically ignored. Nothing happened. Can you explain that?
I don't think, I
That
think
was a
if you are an
law.
administration that's not accountable and the legislative branch does not hold the administration accountable for the failures, then you get this, which is indifference. There was indifference towards, in my experience, there was indifference towards the looming deadline of an overcrowded emergency. And we had 4 years ago, when I was first elected, we held a briefing with the director, and the director, what's your plan? I remember Senator DeBoer was brand new, and she was like, wait a minute, I'm new at this, but what's your plan? And there was no plan. There was no plan. And the communication from the executive branch was, look at the statute, there's no consequence. Well, they were supposed to examine to see if they had more people eligible for parole. But there was never any sense of urgency for the impending overcrowding emergency. And even after that came and went, and we're still in one, even after that came, there hasn't been meaningful efforts to address.
So again, we've talked about sentencing reform, and I mean, those are the two ways to address this, or sentencing reform and programming, to make our communities safer, to make sure that we know that 96% of the inmates that are going to be released, and we are just fine with releasing them without programming. It's, I think, one of the greatest disappointments about this 8 years in the legislature for me. A complete barrier every single time. No, we aren't going to do it that way. No, we aren't going to be smarter on crime. We're just going to lock people away. And gosh, we expect by the day that they are released that they're going to be safer and better human beings, more capable to live next to us, next to Senator DeBoer. And it's just, this is the definition of insanity. It's probably one of the most disappointing things. I've been vice chair for 8 years, and we have continually hit this barrier after barrier. And, I think the legislature owes some apologies to the people of the state of Nebraska, because we are not spending taxpayer dollars wisely. It is not fiscally responsible what we're doing. And I think the citizens of Nebraska need to rise up and talk more to the senators and say, we're expecting wiser legislation. We're expecting wiser use of our taxpayer dollars. Thank you.
Okay.
And Senator Lathrop, you're going to lead this today, I think. So.
Okay, we will begin with Interim Director Sabaka Ryan. Good morning and welcome to the Judiciary Committee.
Good morning, Chairman Lathrop and members of the Judiciary Committee. My name is Diane Sabad-Karine, SABATKA-RINE. I am the Interim Director of the Nebraska Department of Correctional Services. This past year has been a productive one for NDCS. Since emerging from COVID, we have been able to get back on track with initiatives that were previously delayed. And 1 year since the compensation increases were implemented, we continue to experience steady hiring and low turnover. Since the start of 2020, the agency has hired almost 700 people. Of those, nearly 300 are from other states, and many are coming to us with former correctional experience or have military or law enforcement backgrounds. We have hired new team members from 39 states. Given the staffing challenges that NDCS faced this time last year, this is remarkable progress. Based on current numbers, the agency is projected to close 2022 with a total agency turnover rate of about 12%. Turnover among custody staff is around 18%. Those numbers represent historic low turnover rates, the best in more than a decade. While we recognize the importance of pay in attracting staff, we also know that job satisfaction, work-life balance, employee engagement, and other factors help determine how long people stay. We are back to having regular leadership academies and other online and in-person activities aimed at giving staff opportunities to learn and develop their skills. We are currently participating in the latest engagement survey through Gallup, a partnership that goes back to 2019 and has produced positive results. Mandatory overtime has dropped significantly and staff morale has greatly increased. All those things are important because when our staff members are in a good place, they are better able to securely manage and work with our inmate population. For a third year in a row, our reentry success rate has increased, now to 70.2%, which puts us among the top 1/3 of all states. This summer, we were able to return the Nebraska State Penitentiary to a normal operating schedule. We have also expanded operations at the Tecumseh State Correctional Institution and the Reception and Treatment Center to 5 days a week. Those facilities are still operating on staffing emergencies, but we hope that continued hiring and training of new staff will allow us to move those facilities back to normal operations very soon as well. In May, the Reception and Treatment Center opened, combining the Lincoln Correctional Center and Diagnostic and Evaluation Center. We are working toward filling the 2 384-bed units at RTC. That location will allow NDCS to house males in maximum security, those who demonstrate the greatest need for living in a structure, higher security environment. It includes day room space, program space, and other features that are designed to best manage those who present the greatest behavioral challenges in our facilities. Inmate activities have returned in full swing, and we have in-person volunteers and program partners interacting with them again. One of our success stories involves the use of our intentional peer support specialist, inmates who are trained and certified through the Mental Health Association to provide mentorship, companionship, and guidance to fellow inmates. What started with a pilot program has grown to 82 inmates, 78 of whom are still incarcerated. 37 inmates who will work alongside staff to facilitate T4C, a cognitive behavioral program. 14 inmates are being trained to serve as facilitators for 7 Habits on the Inside, developed in part by Franklin Covey. Throughout COVID, approximately 5,000 inmates discharged from NDCS. That speaks to the continued efforts of our licensed clinicians to provide timely and effective clinical treatment to inmates with issues related to violence, substance abuse, and sex offenses. Clinical treatment is a vital part of the agency's commitment to rehabilitation and in many cases is required for individuals to be paroled. The department continuously monitors inmates who are nearing parole eligibility and provides the opportunity to participate in treatment prior to their parole eligibility date. While some barriers exist that are outside of our control, such as inmates refusing treatment, engaging in violent behavior, or having a sentence too short to complete treatment, NDCS does everything in its power to ensure that the clinical treatment needs of our population are met. The agency puts significant effort toward meeting its statutory duties and being good stewards of taxpayer dollars as appropriated by the legislature. We look forward to what we will achieve in 2023. At this time, I am happy to answer any questions that you have.
Very good. Thanks for being here. Senator DeBoer.
Thank you very much, Senator Lathrop. Thanks for being here. You've now been like twice as long the interim director as the last time you were here. So I have some questions for you about programming. Is programming sort of back to normal at Tecumseh? Or is it still being affected by the modified operations, which I think you just mentioned were less modified, but still modified?
They're still slightly modified, more so on Saturdays and Sundays. So programming is on a normal schedule at Tecumseh, to the best of my knowledge. The only date that might be effective is any Friday programming.
Okay, thank you. And does overcrowding continue to affect the ability to provide programming?
I don't believe that crowding does. Again, we do a great job of managing program lists using either parole eligibility date or tentative release date, whichever is closer. And based on that, we're able to put inmates in programs within 3 years of their discharge of parole eligibility.
So one thing that I've talked about with Frakes in the past is that we're sort of back heavy on the programming. So we don't give people programming when they first get into the system, but it's at the end of their system. And that sounds like what you're still talking about is that you're making sure they have it within 3 years of the end. Do you have any knowledge of how far from when they first come into corrections they're getting their programming, and what would make that something that we could move closer to the beginning?
So our goal is for individuals who have non-clinical programming recommendations to complete those in the first 1/3 of their sentence. So those are the front end programs. Those would be cognitive programs like MRT or T4C. Certainly, the clinical programs are during that last 3 years, because based on clinical recommendations, programming at that time is more beneficial to them as they prepare for reentry into the community.
What about doing programming both at the beginning and the end that's clinical in nature? I just don't have the benefit of this information that you do. So you said that it sort of does the best for them at the end. I've heard that argument before. So if that's true, could we do some sort of like, when you first get here, clinical programming to sort of make sure that they're doing productive things while they're incarcerated, and then have the programming at the end as well?
So I think that, we could consider that, but again, I would rely on the clinicians and studies that would tell you when that programming is going to be most effective.
Well, it seems if we would do both, I mean, you'd have the effective stuff at the end still, and I don't think it would be disineffective to have additional programming.
I think clinicians might tell us that if you don't provide the programming at the right time, it might not be of benefit to the individuals completing it.
Okay. Well, something I can look into. Thank you. Then another thing, I was told by the previous director at one point that, well, let me just ask you, how full do your programming classes have to be in order to proceed with the class?
I think each clinical program has a different class size. So there have been occasions if we don't have the full complement of individuals for a class, we can, if it's appropriate, to move them from one facility to another so that we can do the full complement. But they will have the class as scheduled, whether there's a full complement or 3 less. Obviously, they prefer the full classes simply because it's more effective to have a full group. But we don't cancel a clinical program class because there's only 1 or 2 people. We would move those 1 or 2 people to a place where they could participate in that program.
And do you have the staffing now on your transportation staff in order to move people?
Our transportation staff primarily moves our inmates that are transferring, yes.
I mean, do you have enough transportation staff? We've heard in the past in here that you were low on transportation staff. Do you have enough of those folks right now?
I believe all of the FTEs allotted to the transportation division are filled. But again, we would transfer the inmate physically, so we wouldn't be moving them back just for the program.
Right.
We would physically transfer them.
Right. So in the past, I was told that you would not offer classes if they were not full, even if it was the appropriate time for the inmates to get them. So your understanding is that that's no longer the case?
Well, my understanding is, again, we would look for options that we could put the individual into a class at perhaps another location. But we'll do everything within our power to ensure that they get those clinical programs when they're recommended for the treatment.
Okay. Okay. And when in their sentence do the folks get their alcohol and drug treatment?
So again, that's a clinical program, so it'll be offered at the end of their sentence within that 3-year window.
Because at one point I was told it had to be in the last 6 months, but it's the last 3 years.
Within the last 3 years, yes.
Okay. And do they have to be in any sort of special facility in order to get those drug and alcohol treatments? Because at one point I was told that they needed to be in order to have inpatient treatment for alcohol or drugs, that they needed to be in one of the transitional or community corrections facilities. Is that the case?
So currently, we offer the 2 residential substance use programs. One is at the Nebraska State Penitentiary in the minimum security housing. The other is at the Omaha Correctional Center, which is a medium minimum security housing facility. Then IOP and OP, which are the outpatient substance use, are generally offered at the work ethic camp in McCook or us, the community corrections centers.
Okay, so would there ever be a situation where someone was eligible or supposed to be in these inpatient drug or alcohol treatments that they wouldn't be able to get there because the facilities that offered them were full? I mean, I know you said that you have them in an NSP, but is there ever a problem where you can't get folks to the right place to get those treatments?
So again, they would need to be either medium or minimum custody to participate in either one of those programs. So we could look at a classification custody override to facilitate their placement. That will be dependent on their behavior in many cases and whether or not it's safe for them to be in those lower custody options.
Okay. The restrictive housing, can we turn to that now for a second? I know you all have been making some really great progress on restrictive housing. I was wondering if you could go through with us again. We passed a law a couple of years ago, I can't remember which year, that was to prevent people being in restrictive housing if they had a serious mental illness. Are you familiar with?
Yes.
You remember that one? Okay. So one of the things that we understood after that law was implemented was that the department understood that to mean that if they had drugs or pharmaceuticals that would sort of make them less acute, that would dequalify them for that exception to restrictive housing. They moved to a 3, I believe it was, meant that they could be put in restrictive housing even though they had a serious mental illness, but because it was pharmaceutically affected, they were still put there. Is that still correct?
So I believe the statute says that if someone with a serious mental illness that substantially limits their life activities cannot be in restrictive housing. And so we, clinically, they developed a level of care system. So anyone who has an SMI, anyone in our population is given a level of care. It's a clinical designation. And individuals that are level of care 2 or below can be in restrictive housing. Anyone who's a level of care 3 or above cannot reside in restrictive housing. And those levels can change based on the individual circumstances. So our mental health providers assess them on a frequent basis. And if their level goes higher, that would prohibit placement in restrictive housing, we would find alternative housing for them until they become more stable.
So once they're in restrictive housing, you continue to do that classification evaluation?
Our providers do, yes.
Yes. And how often is that reevaluation of their classification done?
It can be weekly, it can be monthly, it can be daily, depending on the individual's needs. Again, we have providers available in our restrictive housing unit that closely monitor this
because we certainly don't want anyone who has that level of care 3 or above to remain in restrictive housing. We want to get them the assistance they need outside of that environment.
And when you say your providers, who do you mean by that?
So it can be a psychologist, it can be a licensed behavioral health practitioner, it's a qualified provider.
And we know that those are staffing positions that you're very short on right now.
Correct.
So is that causing trouble in terms of making sure that everyone is at the right classification level because you are short on that position?
It's a priority need for us, and I'm not aware of cases where they've been unable to do those required assessments of the restrictive housing population.
Okay, thank you. That's helpful. That's all.
Senator Pansy Brooks.
Thank you. Thank you for coming, Interim Director Scott Ryan. Just following up a little bit on what Senator DeBoer said. So people come into the prison with drug addictions and you don't deal with them until the end of their sentence? So they're just struggling with coming down off of the drugs and there's no help whatsoever.
So typically before they arrive with us, struggling coming down, they've already had a period of county jail time before they're sentenced and come to us. So certainly there are non-clinical programs available to them. We have AA available. Some facilities offer NA. We have educational opportunities available to them, but that clinical program that addresses whatever their substance use needs are does not happen until the end of their sentence.
That seems, is that best practices across the country?
Again, my understanding is that that is based on the clinical recommendations of when that programming will be the most effective in our environment.
Is that our clinical recommendations based on money, or is that best practices across the country, clinical recommendations?
I can't answer that question with certainty, but I don't think it's just us. I think there are clinical studies that suggest that.
Okay. I also am wondering about what the status is of the electronic medical records project. What's happening there?
So I can speak to that. I was not intimately involved in the onset of this, but I have a little bit of historical perspective in that I understand that the legislation was initially passed in 2015. And at that point, the plan was to buy kind of an off-the-shelf EHR. So while the purchasing process was being initiated for that, some of the ground foundational work began, and that included the electronic medication administration record was established. They converted the diagnosis codes from the DSM-4 to the DSM-5, and they implemented what is a clinical format for notes so that we had consistency. They're referred to as SOAP notes, but that's so that all of the clinical notes were in the same format. So that work went on behind the scenes. At some point, the decision was made that the off-the-shelf product would not serve the department the best, in that it was a standardized product. You could customize it to meet our needs, but of course, with every customization, that would be a higher cost. And it would not integrate with our NICAM system, which is our electronic database for our entire population. And so the decision was made that the EHR would be built in-house, and work began on that. I think it was in October of 2019, 16 or 17 of the behavioral health modules went live, so those are in process. We are working on other modules. One of the other benefits of doing it in-house is you can have that rollout so that it's easier for our team to adapt to using. So it's in process. I recognize it is not as far along as you would like it to be, but I think recently Inspector General Kobernick suggested if it was not done by July 31st of 2025, that we need to go a different direction, and former Director Frakes committed us to having that system complete before that deadline.
So that's your understanding, is it will be completed by October 2025?
July.
Oh, July 2025. Okay, so another few years. And do you have a feel or an understanding of what the cost will be?
I don't know that off the top of my head. I think that we can provide that information to you.
I I think that'd be great if you wouldn't mind. Are you one of the finalists for to take over the Scott Frakes position as director?
I think our new governor will determine that.
Okay, but will you be submitting your name?
I am interested.
Okay, so do you have ideas on what can improve with our correction system? What you can see how there are changes to be made, what you could do that's different? I mean, you might as well have the legislature supporting you, right?
Well, I appreciate that. Thank you. So earlier, there was conversation about meaningful change in the agency. And while I certainly respect what everyone said, I have witnessed meaningful change in this agency over the course of my nearly 40 years, and particularly in the last 7 or 8 years. So I think that there are many things we can still improve upon. And I don't know that that will ever change. I think that we can look at more non-clinical programming to offer. I think we want to see what the fidelity of our programs that we do offer is, and that the study that we are doing will give us that information. I think certainly we need to make sure the classification tool we use for the custody to determine custody levels of our population is important for us to know. So that work will give us kind of a roadmap for what we need to do differently there. I think we can continue to improve the quality of life in many respects for our population by looking at those pro-social meaningful activities, many of which that come to us through the VLS providers that we have funded money to come into our systems and work. But I think that corrections evolves constantly. I think there are best practices that many of our neighboring states and states across the country use. I think it's important for us to be open to those new programs, new initiatives, new ideas, and do whatever we can to engage our population in that meaningful change that they need so that when they return to our community, they can be better citizens.
Okay. Thank you, Interim Director. I have no further questions.
Senator Brandt.
Thank you, Chairman Lathrop. Thank you, Director Spaka, for being here today. I appreciate the fact that we have somebody with 40 years' experience. Was that all in Nebraska?
It was.
Even better. So first question, where are we at on the facility study and the classification of inmates study?
So I think when you speak of the facility study, it's what we commonly refer to as our master plan. So I believe we signed the contract for that in September of 2021, and it is in the final stages. So I am confident that document will be published and ready for release before the end of this year.
Okay, what about the classification of inmates?
So the classification study, I'm going to just check my notes here because I'm trying to keep everything straight in my head. So we initially did the statement of work with UNO for that back in August of 2021. I think there was either some misunderstanding or miscommunication. Assumptions may have been made that were not accurate. So there was a more recent amendment to that work this past August. But meanwhile, I mean, data was provided to UNO as early as August. They did staff interviews. They've done a lot of that groundwork. And my understanding is that that project will also be completed with a report by March of 2023.
Okay. Next question, what is the Department of Correctional Services relationship with the Office of Inspector General? How would you classify that?
I think we have a cordial relationship. I mean, it's common that the Inspector General requests information from us and we provide that. Certainly the reports that he produces, we review them. We respond to those as required. We each have a role in our system and we respect that role.
We had a bill on domestic violence, my death review team, last session. I have received a lot of questions. Does the Department of Correctional Services provide a domestic violence treatment program, or is that part of the programming that inmates get? I cannot answer that question. I don't know if you have an answer to that.
We currently do not provide domestic violence programming inside our facilities. Individuals who are in community corrections can attend domestic violence programming in the community. It's not that we are unwilling to provide it, but there has been some concern in the past, as I understand it, that the programming provided inside the facility may not meet the requirements of probation or parole in the community. So we have a meeting later this month to meet with probation and parole. If it's something we can offer, we will certainly implement that within the facilities, as long as it meets the requirements that they meet in the community.
Okay.
And I just want to add to that domestic violence is not a clinical program. So it's a cognitive program. So it does not have to be provided by clinicians.
Okay. The last one is 4 years ago when we sat in our first meeting, Senator DeBoer and I did with Director Frakes. It's the same question. What can we as the legislature do? What's the number one thing that we as the legislature can do to help you succeed?
That's a big question. Certainly support the initiatives we request, and I think that you all have done a tremendous job doing that. Probably the number one thing on my list is the replacement facility for the Nebraska State Penitentiary.
Do you have a new cost on that?
I don't have the new costs, no.
All right, thank you.
Thank you.
Director, I got a few questions for you. As you might expect, you've been with the department for 40 years.
Nearly 40 years.
What did you start out doing,
A
Director?
correctional officer.
You were a correctional officer. You've moved up the food chain. You were a warden at a facility too, am I right?
I served as a warden at 3 facilities, at the Diagnostic and Evaluation Center, and then the Lincoln Correctional Center when they were separate, and then the Nebraska State Penitentiary.
And how many years of experience do you have doing the warden?
I think 10 in total.
10, and then you were brought into what we generally refer to as the front office.
Yes.
Yeah, how long ago were you brought into the front office?
In May of 2015.
So for the last 7 years, you've been an assistant, or is the title before your current title deputy director, or is it an assistant director? What's the proper term?
I did serve as a deputy director, but then I was in the chief of operations role most recently.
Is that a deputy or an assistant deputy?
Actually, as the chief of operations, I oversaw the 4 deputy directors, so
Okay.
all 4 divisions.
So if we looked at the organizational chart, there's Frakes, and then there's you,
Correct.
and then some deputy directors, then some wardens.
Correct.
Maybe simplifying it a little bit, but just so that we understand where you fit in the organization since 2015 and what your 40 years of experience involved while you were at the front office. And the reason this hearing was important to me is we don't know if you're the next director or not, or who the next governor will be, but we do know we're ending a legislative session and an administration, and having some kind of a where are we at and what are the loose ends, if you will, at the end of this administration, I think is important for us to cover today. And that's why I offered a number of topics, including electronic medical records, which you've already talked about. I do have some questions for you, and I'm going to run through a number of different topics, but I think they're all within your experience or within your knowledge. I'm not trying to trick you today, in other words.
Thank you.
Okay. So where is our population at as a percentage of design capacity that's open and operating today?
I think this morning we are at 149% of our design capacity.
Okay. And we recently opened the RTC, which is this building that is built between what used to be D&E and LCC.
Correct.
And that apparently was designed to create some efficiencies and a little more capacity. Is that right?
Capacity only in that with the skilled nursing beds and of course the secure mental health beds that are also in that complex that's open.
Right. it marginally improved our capacity, but there's supposed to be some efficiencies with the RTC.
Certainly.
And we're at 149% of design capacity today. We have had an opportunity to tour, a number of us have, the 384 beds. You have a 300, the legislature appropriated the money and the department has constructed 384 high-security beds. Am I right?
Yes.
And those are high-security beds.
Yes.
Okay.
Maximum custody.
Maximum custody, being for the highest security level of offender.
Correct.
That highest classification. So tell us when that was supposed to open originally.
June stands out in my mind as the initial date
Of 21 or 22?
of 22, I believe. But that could be off.
I thought we were going to open it like at the beginning of the year, maybe in February.
I wouldn't argue that.
Okay. And it's not open yet.
The 384 is not open yet.
Okay.
Correct.
Why? Tell us what the holdup is with the 384 beds.
Well, I think much of the holdup had to do with some of the construction delays in that COVID happened during that time period. There were some supply issues, but we are very close to being able to occupy the 384 beds.
Okay. Are you going to be able to staff it?
Yes.
You got all the security staff you need to open that?
RTC still has some vacancies. I don't know the exact number, but they are staffed sufficiently to operate the 384 bed. And there's actually 2 units in the 384. So one unit is slightly behind in the finished work for completion. So we will open one unit, continue to hire staff, and then we'll open the other unit. But I anticipate both will be fully operational before the end of the year, absent any other unknown delays.
Okay. And I want to ask about that because my recollection is when the Appropriations Committee was presented with this proposal, it was for the highest security level of individual incarcerated at the department. True?
True, general population.
It was, I don't know if you're qualifying my answer by saying general population. It was supposed to be 384 beds of the highest level of security inmate that the department houses. Is that true?
True.
Is there any plan to house individuals in those 384 beds that are not the highest level of security?
Not that I am aware of. no.
Okay, so when we open that up by the end of the year, 384 beds will be filled with the highest level of security individual housed at the department.
And I qualify that as general population because we also have our restrictive housing units. Those are really our highest security. Those are the individuals that need to have that separation from others. The 384 is general population, maximum custody housing.
So is the 384 beds, is some of that going to be put to restrictive housing use?
No,
Then I'm not tracking with you. I asked, are these all going to be the highest security level individuals? You said yes, and then you said general population, restrictive housing.
from a correctional perspective, individuals that are in restrictive housing are in our most secure, our highest security level. So these are not restrictive housing beds. These are general population beds. So it will be a general population unit filled with 384 maximum security general population inmates.
And they will be individuals classified as maximum
Correct.
security. Okay. In 2021, we passed, the legislature passed LB 383, which was an appropriations bill that included AM 911. Are you familiar with that?
Not the numbers, if you could help me a little bit with
Okay,
the
yeah,
content.
and believe me, I'm bad at that even after 12 years. But this was an appropriations bill that required, among other things, that the department develop I want to find the right terms. $500,000 for the preparation of a program statement and site selection for a new halfway back correction center in Omaha. You familiar with that appropriation?
I'm familiar with the bill you referenced.
And the fact that the legislature appropriated $500,000 for site selection and a program statement for a halfway back house.
Yes, I'm familiar with that.
And have we developed a program statement and identified a site in the Omaha area? This was a 2021 bill. Have we identified a site, and do we have a program statement for a halfway back house?
We have a program statement for a 96-bed community transitional facility.
And no halfway back house?
I think that it's referenced as a community transitional facility.
It is. And I'm going to, and you were not at one of these meetings, but at one point when this wasn't done by the beginning of the year, which was the expectation I think Senator Stinner and myself had, that because this was in a 2021 appropriations bill, that by the beginning of 2022, when it came time to show up here and legislate, that we would have a program statement. And the concept of a halfway back house was something Senator McDonald and I talked to the director about, as well as the governor and Roz Cotton. And a halfway back house was to be a facility where individuals who were on parole and had technical or low-level violations could be brought back to a more structured environment. What we got instead is this program statement for a community transition housing, which is substantially different mission than a halfway back house. You would agree with that?
Well, I can't say with certainty. I'm not sure what a halfway back house is based on your description. This could serve, the transitional housing could serve a variety of populations.
I know you don't, because you weren't in the meetings when I met with the governor, Roz Cotton, and Director Frakes, where we discussed this and everyone thought it was a great idea and agreed and understood what a halfway back house was. And that's why I'm dismayed that instead of a design plan and a site selection for a halfway back house, we have a transitional housing. What makes that even more frustrating was when Roz Cotton was here and I asked her, how much transitional housing do we need? And she said, I have no idea. I just want the record to reflect that we appropriated $500,000 for a design plan and site selection for a halfway back house. And the homework that was delivered by the department, if you will, was a community transition housing statement, program statement, delivered July 15th of 2022. Have I misstated any of that?
Again, as you mentioned, I wasn't involved in that, so I'm.
Okay.
Yeah.
Okay. That same bill required that we have a facility study, and this was an appropriations bill passed in 2021 when we began having serious conversation in the legislature and in this administration about building a new prison, right? And if I understand, I can tell you what my expectation was, and I think I can speak for Senator Stinner and the Appropriations Committee. We thought the facility study would be done in time, that it would be available to us in January of 2022 so that we could compare our needs in the master plan to the proposal put forth by Director Frakes. And today your testimony is that the contract was entered into in September of 21.
I believe so. We can certainly confirm that date.
Do you know why it was not completed before January of 2022?
I do not know. I do know that it's an extensive project and it requires the consultants that we hired
to visit all of our sites, to talk to staff at the facility, certainly to speak to the administration of each facility, to work with our engineering to get, our building designs, and all of those sorts. I mean, it's extensive work, but I can't answer specifically why it was not done by last January.
You believe that facility study will be done by the end of the year?
Yes.
What involvement have you had in that master plan, the development of this master plan, or the implementation of this contract?
So I was involved in some meetings toward, I think probably over the summer they were held. A draft had been provided. Some of the facility schedules weren't accurate, so we got them accurate schedules. It was kind of like, the proof process at that point, to make sure that the content matched what our current operations were today.
Were you involved in that meeting this summer?
Yes.
And did you receive a copy of the draft before that meeting?
I don't know that I received one before the meeting. Certainly we reviewed their draft at the meeting.
And so at what point in the summer? Was that in June or May or July?
I can't tell you for certain. I'm sorry.
Who is preparing the facility study?
Dewberry.
So they are, actually what we asked them to do is amend the 2014 or update it. Am I right?
So they're updating the 2014, but as you're aware, much has changed in our agency in terms of building and construction, and certainly our population since 2014.
In the draft that you saw, did you have an opportunity to review it at this meeting?
We reviewed it at the meeting and went over specific sections of it, yes.
In that draft, does it propose using any part of the penitentiary for housing inmates? Or does it include any part of the penitentiary as beds in our inventory of beds for the Department of Corrections?
My recollection is it is a snapshot of today's facilities, so the penitentiary would certainly be included.
Is it your expectation, or is it the expectation, as you understand it, that when we, or if we were to build these additional beds, that the penitentiary would be somehow rehabbed and put into use for lower custody level inmates?
So at this point, my expectation is that a new facility would be a replacement of the Nebraska State Penitentiary. Certainly, if we look at population projections, currently, they appear like they will be increasing over the course of the next few years. If there are reforms that happen to reduce the projection, we would not have a need to repurpose the NSP for anything. And again, the new facility is a replacement project for the NSP.
So, and I don't want to be argumentative, but sometimes I hear qualified answers and I want to try to parse yours a little bit. When we hear at this point in time, or if there are reforms and our population doesn't grow as we expect right now, we're not going to repurpose it. But isn't it true that you expect to repurpose the penitentiary, and that's been true since the time the new facility has been proposed?
Personally, I do not expect to repurpose the penitentiary. It is my hope that our population can decrease, but I think that you have to go into this with your eyes wide open. And we have a responsibility to house inmates. And if those projections don't take a different direction, even the replacement facility will not give us the space we need to meet the needs of the population projection.
I appreciate that answer. And this is what I'm hearing you say, and you can tell me if I'm wrong. We're not closing the door on repurposing the penitentiary. And in fact, we probably will have to repurpose it unless there is some change in our population projections. Would that be a fair interpretation of what you've said?
If I could qualify that, I'm closing the door. I am not locking the door because I don't know what our numbers will look like.
But if the numbers continue as projected, you'll need to repurpose the penitentiary.
We'll need to have additional bed space. I don't know if that includes repurposing the penitentiary or if that includes other options that we've not yet explored.
And by other options, that would be even more beds than the director proposed.
It could be.
Well, you have two options, repurposing the penitentiary or building even more beds than the director proposed in the proposal he was walking around for the last 2 years. True?
True.
Okay. I just have a couple more things. I want to talk about these two studies that we, the legislature, basically commissioned in legislation. And one was program evaluations. And in 2015, LB 605 included the directive that we have, the department shall evaluate its programming and may enter into contracts with outside organizations to do that. We've never done the program evaluation required in LB 605. Is that true?
I believe we did an in-house evaluation initially, and then we had turnover and vacancies and lost momentum. But I believe we had someone in our research division who did an initial evaluation. It wasn't of all programs, it was of a program. Certainly had potential.
Did you say of a program?
Yes.
Okay.
And
So
it could have been one or two programs, but it wasn't extensive in all of our. But then we had some turnover, some vacancies, and we lost momentum. And so with the 2022 legislation, we have now contracted with UNO to do that study.
and that's LB 896 that requires that you shall evaluate and you shall use an academic institution. Do you have a contract with UNO today to undertake that evaluation of our programming?
I believe we are in the process of finalizing the statement of work for that project. And they are planning to begin that work no later than January. Sooner if they can.
Was there any challenge from the perspective of the department to entering into a contract with UNO to do the program evaluations sooner? It doesn't even sound like you have a contract signed yet. Am I right?
I don't believe that the statement of work is signed by both parties yet.
Can you tell us why that hasn't happened or why that didn't happen, say in May?
I
I'll just
can't
use that
send
there.
I was not involved in it back in May, and I don't have an answer to that question.
When did your involvement begin?
About 6 days ago.
Okay, that's fair. We also required in LB 384 in 2021 a classification study.
Correct.
That's one, to be honest with you, I thought we would see by January of 2022. Where are we at with a classification study that we legislated in LB 384 in 2021?
So my understanding is that the statement of work for the classification study was in effect in August of 2021. UNO initially, we provided them data. They began doing their analysis. They've interviewed our staff. They've been into our facilities. And then in August of this year, there was an amendment to that statement of work. And so they are scheduled to have that completed by May of 2023.
Who amended the contract that was entered into in August of 21, a year later?
I assume that it was Director Frakes. I've not seen, I don't remember the signatures on the amendment to the contract.
Do you know what the substance of the amendment, what, did we change something substantially or nominally?
I think that there was, again, some miscommunication, misunderstanding, whatever the case may be. And so based on what we were seeing, it wasn't going to give us the product that was responsive to answering the questions that we had about the classification tool that we're using. And so they did some clarification in this amendment, so that when we get our report in May of 2023, it will provide the information to talk to us about the effectiveness of our classification tool.
I think that's all I have. Anyone else have any other questions? Senator Geis.
I know that you, this is going back to programming, have clinical programming that you all traditionally offer later in the sentencing or in a person's sentence. So it goes over the past 3 years or the 3 years before they transition out. Do you have other programming that inmates are involved in that keep them busy or give them educational value while they're incarcerated that is before that clinical programming? And if so, is that all optional or is it any of it necessary for them to qualify for parole?
So we have a host of non-clinical programs that are offered throughout an individual's incarceration. The cognitive evidence-based programs that can be recommended based on the strong R evaluation or score that the individual receives. Our goal is to offer those within the first 1/3 of their sentence. Inmates, of course, have the option not to attend ever. Those programs will not adversely affect their eligibility for parole when they are eligible. The clinical programs, however, that we offer the last 3 years of their sentence with us or time with us could impact their parole.
Okay.
And then we have lots of other programming opportunities that vary from facility to facility. I referenced previously, we have our VLS providers that come in and provide a host of programs. So that's one of the things when we spoke of meaningful change that I have witnessed over the course of the last 7 years is many of those things that we've been able to bring into our facilities.
Have you heard of in other states how some of the non-mandatory or non-applicatory programming, how other states do good time where they can, an inmate can actually earn time off their sentence by participating in programming and educational opportunities where that could affect the sentence? Have you heard of that happening in other states?
I can't think of any specific states, but it would not surprise me if some states still have those kind of good time credits.
Would you see that as being an incentive to someone to take earlier programming that may not be clinical in nature, but would help them adapt better to what's going on inside, or just enrich them personally?
So I think that it would be an option that certainly we could look into and study. Again, I don't know if states still do that. I mean, I know years ago when I worked in records administration, that was not unusual. And at one point, Nebraska gave good time to individuals for donating blood. That was many, many years ago.
Yeah. I remember that in other states too. There are a couple of states that do that. I know South Carolina is one that does all good time by earning it in different ways. But and the other thing that I wanted to just ask is opportunities for job training. Is that something that the department is looking at with businesses maybe outside the community or in the communities where the facilities are? Is that something that's being investigated currently?
So again, we have some opportunities through those VLS providers, and certainly for individuals when they get to community custody. Our Cornhusker State Industries has, the opportunity for individuals to do internships to get certification, to learn those trades that they can use when they get out. So we have the Home Builders Association that has a program at the Tecumseh State Correctional Institution, again, providing them those skills that will help them with their reentry.
And if that were to be broadened, is that something that the department would be interested in partnering with other industries that may want to get involved with?
Certainly. I mean, we have done that over the course of time at different facilities and with various organizations in the community. Whatever we can do to provide skills for individuals so that when they return to our communities, they have opportunities for meaningful work there. We're always interested in looking at those.
Thank you.
Okay, I don't see any other questions. Thanks and
Thank you.
good luck.
Thank you.
Next testifier.
Hello, members of the Judiciary Committee. My name is Michael Chipman, Michaelchipman. I am the president of FOP 88, which is the union that represents the correctional officers, correctional caseworkers, and correctional sergeants that are in the facility. So some things we just kind of want to go over, kind of, I guess the state of the department, good things and some things that need definitely improvement. Staffing has significantly improved. We're down to 150 staff vacancies compared to the almost 500 we had at one time from our calculations. That is definitely a good thing. Some of the facilities that are doing really well with staffing are CCL, CCO, OCC, WEC, NCYF, and NCCW. They're doing very well. NSP is doing significantly better as well. And then places that have challenges are definitely Tecumseh still having some challenges, and RTC is by far having a lot of our challenges. And we'll kind of go into why we think some of that is. And so because of the less vacancies overall in most of our facilities, staff morale has greatly increased. So the concerns we are having currently are going on is that our rate of new hires is down to only 20 protected service staff per class. To give you an idea, a month ago, our average was probably closer to 60. And so it is concerning. That's the next two classes each only have 20 in it of protected services. So that downtick is concerning. The new unit at RTC needs post orders, and it also needs emergency plans put in place for the new clinic that they just put in.
I'm sorry, Mike, what'd you call that?
The clinic, post orders and emergency plans.
Post orders?
Yeah, sorry, correction speak. So it's some facilities call like operational memorandums. It's telling you what to do in that area. This is the rule. This is how you are to run it. Things of that nature. And so, it's obviously important. Every post should have a post order because there's a certain way that things need to be ran and things of that nature. And a lot of like the clinic, there's currently none, and there's no emergency response plans in the clinic as well. So if there's a fire, we don't have an active plan that is known to the staff when I was talking to them. And if you guys need to stop me anytime, go ahead, because I know I talk fast. Training needs to be improved greatly as well. I talked to staff, particularly at RTC. One guy who was running the clinic, he said he was by himself in this, we refer to it as a bubble, but it's actually a control center. And it's clearly meant to be a two-man post. One part is supposed to watch the actual skilled nursing facility, and the other part is supposed to watch the secure mental health housing, and he's doing all of that. And he was fairly new. And when we talked to him, I said, do you know how to do this? He's like, no, I'm learning today. And there was no one training him. And then I've had multiple reports from staff that multiple doors are being opened, which is a high risk situation. Obviously, with that clientele, they can be rather spontaneous and dangerous. And so opening multiple doors at the same time can be deadly, frankly. And so that's just kind of a little breakdown. Also, a lot of staff have complained about the new units there, about training. They started training, I believe, around 2 weeks ago. And there's a lot of concerns with it. I have heard that they've moved back the new, at least 2 weeks for the new place. And part of that is due to training. So they are hopefully going to start addressing that. And when I talked to staff about training right now, all they were doing was like scenario based, which obviously if you don't even have post orders and know exactly how to run it, scenario based isn't really that
When
great.
you talk about the new facility, you're
I'm talking about the
300
384, sorry. Yep,
The
the 380.
384 beds.
This is the 384, sorry.
Okay.
Yep. And so that's an issue. Minimums are also a large concern at RTC. We believe that the minimums, so when I say minimum, sorry, I'll explain, is the minimum amount of staff for it to run safely. We believe it needs to be up to at least by 20. And I didn't bring it with me, but there's a really good IR that was written by some staff there that really know the facility and explains why you need these extra positions. Just an example, part of the minimums of that clinic I just got done explaining, it should clearly be 2, but it's 1. You have 1 guy now watching one of our most dangerous population and watching the skilled nursing facility. That's just not really acceptable. And I mean, there's 2 different computer screens that they've lumped into one, and you can tell this is supposed to happen on our computer screen. So, you know, we believe that, you know, I don't know if like a staffing analysis or something of that nature to say, which we're probably going to address in bargaining, that the staff need to be at a certain level because just for safety. It's actually when we're talking to staff leaving RTC, it's their number 1 concern is that they're saying that they're not being allowed to work overtime. I don't know if it's budgetary or what that nature is, and they don't feel safe. And so since they don't feel safe, they're just like, I'm quitting and going back. And so that's probably our biggest turnover problem at RTC right now, is that, you know, you have staff like this new guy in the bubble by himself. He's not going to want to, you know, continue to keep working there if he feels that unsafe, or he's juggling these people's lives and you know, he doesn't have any real experience. So, with them not, like I said, by far the largest part is them not allowing overtime. And so they're only allowing them to fill up to what they believe is the true minimum. And like we said, the minimum should be at least 20 higher. They won't let them fill up, and people are willing to volunteer and work it. That they're saying no. I don't know if it's budgetary or what the reason is. And then another large concern is that the new 384 building, the staff are not going to have vests. Currently in housing unit 2C at Tecumseh, the staff have vests, and that.
What do you mean by that, Mike?
So stab resistant, or they have a nicer name, but it's stab proof vest is what we call it. And so, you know, that's where it protects your main torso and protects you from getting stabbed and things. To give you an idea how good they are, we had an assault 2 weeks ago at Tecumseh, and a guy got stabbed in the heart, but that vest saved him. He was okay. So, I mean, it's really a critical piece of equipment.
Your guys want people in the 300.
Yeah, because they're coming from that same unit, from housing unit 2C. They want the same vest set, and they're getting told no right now. So it's something that needs to be addressed. And so kind of that gives a big piece of RTC what's going on there. A lot of our big concerns, big ticket items going on there, so to speak. NSP staff vacancies are low. We're down to 20 to 30. The issue we're having at NSP is it's all on second shift. So there's a huge concern that once this 90-day pause, I don't know if you guys are familiar with the 90-day pause, but what that is a rule I believe Scott Frakes created, saying we won't mandatory you since we went off this emergency for the first 90 days. There's no mandatories allowed under any circumstance. That's what I've been told. And so we're about ready to come up. I think it's going to be next week is when the 90 days is up. And so we have a lot of staff that are concerned on first shift that they're going to start getting hit. And as you guys all know in the past, that's how 2015 started. One shift started getting hit, and then they started quitting, and then the cycle again. I just don't want us to lose all this work and time, money, and work we put into this, getting them back to only having 20 to 30 vacancies. And so, and at Tecumseh, staffing has significantly improved, but there's still at least 60 vacancies by the last reports I've seen. And that is also including the 80 staff that are getting still bused from OCC. So there's 60 plus. In theory, I know the department wants to get rid of that program if it could. And so, you know, that's obviously of concern. Another thing that we would like probably the future, and I don't know if this is probably the right forum, but I'm going to say it anyway, is that we would like to work with either the legislature or the governor's office on creating a mental health program for our correctional officers. We currently had 2 suicides in the last 4 months. And so I'd really like us to be able to address that because our suicide rate is sky high right now. And it has been for a while. We average probably say at least 1 to 2 officers a year kill themselves, unfortunately. And so that's kind of something we'd like to, you know, talking about, no programming, but for staff. And so, you know, to kind of cap it all up, you know, staffing has greatly improved, and so has more at most facilities where we are really thankful for these raises and what we've all accomplished together with the Ricketts administration. And, you know, like we said, TSCI is still kind of short-staffed. We've made some significant progress, but there's still plenty to do. And we need to continue to work on the compensation piece. Obviously, not 45% probably, right? But like we got our last month. But the counties are now, Lancaster County is going up to 2780, I believe is what the number I got. And Sarpy County is at 27. They're all within a buck of us. And as you know, so they're catching up. And I know some of them are going back into bargaining. So there's going to be some more natural competition. As you're seeing, our numbers are going down. That's a concern. As I've said many times before, there's only a certain group of people that are willing to do this profession. And so you have to recruit and retain them. So not only the compensation, but these other pieces of safety obviously are a huge concern. And so, we're looking forward, like we have bargaining coming up this year, where obviously we started it technically in September, but we're going to really do the heavy bargaining, I think more in late November, early December, because we're kind of waiting for the new administration, whoever that may be. And so hopefully we can address all that in this, and then, with probably some legislative issues as well. That's it for me.
Okay. Senator DeVore.
Thank you. Thanks for being here.
Yeah, of course.
Is this no vest rule for the 384 beds? Are you hearing that is like their plan indefinitely, or is that just like?
Definitely, they have no plans to put vests in there. I think they're referring to this is general population. Well, I can make the same argument. They declared 2C as general population. The fact is they're our highest risk general population. They have, high tendency towards outbursts and violence. So, and it's a defensive mechanism. It's purely, it's not to harm an inmate or anything of that nature. It's purely to help protect the individual. It's a no-brainer to me. So.
If they offered vests, let's say, do you imagine that if they just put them on offer as voluntary, would everyone take them?
Yeah,
Okay.
absolutely.
So
Currently at like 2C and at RHUs, the staff are assigned vests, just kind of like how police are, and you're expected to take care of it, maintain it. If you don't, then you're responsible fiscally for it and things of that nature. Yeah, so absolutely, they'd be all for it.
okay. You mentioned that I believe it's the 384 beds again, you said that the folks don't feel safe. I suspect that the lack of vests might be one piece of that, but also I'm sorry, it's kind of hard to hear from
No,
the
you're
sides.
fine. I talk really fast. No, you're okay.
Was part of that just the lack of having enough folks and wanting to raise the minimum number of folks there? Was that part of the safety issue, or what's the nature of the safety
Well, yeah,
issue?
so it's a compounding issue. So when I talked to staff, they said that they think they would have enough staff if they would allow overtime in the facility. So, obviously that's kind of a double-edged question, right? So do we have the staff without overtime? No. Do I think if they opened up the overtime back up, because it's 2 times overtime, people are always happy to get 2 times overtime, then we could staff it temporarily that way? Yes, I do. But currently they're really concerned because of all the lockdown overtime practices going on. Like I said, where you're leaving one guy in a bubble that was assigned to, and this is a brand new built clinic. And so things of that nature, people are concerned, and there has been no word one way or the other, that management, how they're going to run that. Because I've been told they've told me how many staff are going to have there, and the allotted amount seems reasonable, but is that going to be their true minimum they'll allow overtime up to, or not? I haven't got clarification.
And are there folks, this has been a little unclear to me, are there folks already in the 384 beds, inmates?
No, staff that have been assigned there, they have about, I'd say 20 or so staff, and they're training there actively for the last 2 weeks, but there is no inmates in there yet.
So the fear that they have is a future,
Oh, absolutely, yeah.
future fear.
Yeah, and I know, and I haven't confirmed this with administration, but I've had a bunch of staff tell me that lieutenants are telling them they're gonna have, inmates come in the next 2 weeks or so, and the tables aren't even bolted down yet, and they said they're gonna leave it like that and fix that in December. So that's stuff like that. It's like, let's not rush this. This isn't something, this could be very dangerous.
Got it. Thank you, that's helpful. I'll say to you right now, if I'm reelected, I'll help you with that mental health program for staff.
Awesome.
So let me know about that.
Yeah.
So when you're talking about the multiple doors opening at the same time, was that in the 384 beds?
That was in the new clinic, SNF, I was told, yeah.
Okay.
Yep. And that's where the one guy running that whole thing, that's the problem. And I've talked to him personally, and he said he's brand new and he's never been trained on it. After I made the lieutenants aware, but they did put him through FTO that immediately, I was told, but still, I'm sure. it's not
Put him through.
field training officer. That's the training yeah. But that should have also been done before he was on the post.
Who watches out for the trainings? Is that something that typically a warden is responsible to make sure that everyone does?
No,
Who
they have
polices
a
trainings.
supervisory sergeant position, and they call it it's a training sergeant, and they're out of our classification. They do the training. The issue they have is that he's in charge. It's one guy for all of RTC, to my knowledge, and he has to watch all of them. That's difficult to do. You also have a bunch of brand new staff. As we just mentioned, we've gotten 300 staff. A lot of those went to RTC. And so it's really hard to maintain all this training, to know exactly where they're going and things of that nature. And the training program has its own issues anyway, because at least at the staff training academy level, that they're called training specialists, and they're under a different union. It's something we're looking at addressing down the road. And they make about $6 to $8 less an hour than a starting staff member. So you can imagine how happy they are to have to train someone.
So this training sergeant, does he help or she help with the placement on a daily basis? So when you're going to get wherever you're going to go that day, does the training sergeant, is that person part of the decision making?
The first 2 weeks of OJT is on the job training, yes. After that, no, then it goes to the lieutenant.
So then, do you have different trainings for different positions within the facilities?
You're supposed to, yeah. And so I think some of that's not happening. Clearly, it's not happening with that guy in the clinic saying he's never been up there, and he was off OJT. So yeah, they're supposed to, like, each area. That's what I mean. We don't even have post orders for that area. So how are we going to train someone on how to properly run it if we don't have rules to properly run it?
So it seems like there's a breakdown then, is what you're suggesting, in sort of, first of all, what the training is for each area, because you don't have your post orders.
Mhm.
And then also some kind of, whoever's putting people into positions on a daily basis, and whether or not they have the ability to check whether people.
Yeah, and trainings get interrupted quite often. An example is I had someone who I was on WebEx with yesterday, and he told me that they canceled his training for tomorrow, and it was a 4-day training because of staffing, what they had told him. I don't know. And so that happens, I'm told, frequently. So when you have mix and mash of training you can imagine chaos.
Yeah.
With a lot of new staff.
Yeah, that's helpful. Thank you.
Mhm.
And then last, you said the concern that you have at NSP is that you're about to end the 90 days, that the shifts are such that the first shift is pretty well filled.
First and third, yeah.
The second is not. So the first shift people, you're afraid, are going to get mandatory overtime.
They are, yeah. It's a constant phone call I get. They're like, what's going to happen? We'll quit if we all get mandatory all the time on first. And yeah, the second shift is by far where most of those vacancies are. First and third, that's always been typical. Third shift, I love when they call it the retirement shift. It's a good graveyard shift. It's easier work. It still has its own inherent dangers. I don't want to make people angry. But then first shift is there's a lot of action going on, and second shift is there's a lot of names, but it's where it's a lot of action happens, a lot of fights, a lot of the drug stuff going on, and so people tend to avoid second shift.
So folks, you say, have reason to not want to participate in the second shift.
Oh yeah. Once you get seniority, 9 times out of 10, I'd say you go to first. You try to get on first or third if you're okay with it.
Interesting. Okay,
That's very common.
thank you.
Senator Brand.
Thank you, Chairman Lathrop. Thank you, Mr. Chipman. I always enjoy it when you come and speak to us.
Yeah.
I'm a little confused. RTC.
Okay.
You guys for years have tried to get rid of overtime, and now you're asking for overtime. Is that a correct statement?
So yes, we are asking for more overtime allotment because the minimums are at an unsafe level. To clarify, we're not talking about more mandatory overtime. We have a lot of staff willing to work voluntary overtime.
But then what happens if you don't have enough volunteers, they're going to have to do a mandatory
That-
overtime.
That is correct.
And you
Yeah.
guys are all right with that?
Yeah, we're okay with that if it keeps us safe. Obviously, our safety is our number one priority.
Okay.
I agree. I don't want a bunch of guys getting mandatory for extra positions that aren't needed. But these are not. I mean, we're talking about one guy running an entire unit. I can give you more examples. I'd be happy
So to start today, I think we're at what, $28.50? Is that an hour? Is that what?
28 even.
28 even. And then overtime's usually time and a half, right? So you'd add
It's
14.
double time now.
It's double time.
Mhm.
Okay, so you'd add $28 to that, so they'd be making $56 an hour.
Correct.
Okay, so if you were managing, if you were on the opposite side now, and you weren't labor and you were management, can you understand why management would try and contain overtime at $56 an hour?
So yeah, absolutely. I understand the manager section. That's why I said I assume it is budgetary. Because I don't know that for sure. And I understand that, we don't want to be using overtime willy-nilly, but we can't be, this isn't a, grocery store or something of that nature. When we cut back on the areas, and it leads it to dangerously low minimums. Sometimes I have 2 people in the yard of that entire facility. That's an issue, right? That we need to have a safe minimums, which may include more overtime. I'm not saying open up the vault and let it, and at one time, there was a little time period where the lieutenants weren't managing it well, and they were letting them go way over, like 20 or 30 over. I understand that's not acceptable, and it's a waste of taxpayers' funds.
And we also understand this is a 24-hour facility, and we have to keep people there,
Yeah.
mandatory or voluntary. Can you clarify something for me?
Mm-hmm.
I had an opportunity to tour the RTC and the 384, probably 4 months ago. The people in Nebraska should be very impressed with the facilities we have there. And you come in here today and tell me the RTC is a problem, and I kind of saw, from a layman's perspective, a state-of-the-art facility. Why is the RTC a problem from labor standpoint?
So it's not the physical layout. The physical layout's fine. The problem is this is, like I told you, our biggest problem by far is them not allowing overtime, and it's creating this unsafe environment, which is creating some of our new hires are starting to quit. And as you see, we don't have a huge back door behind us. We're only getting 20. So that's by far one of the largest. There are some issues with any new building, of course, with some of this stuff that we could point out. But overall, I agree. It's a very nice facility.
So from a labor perspective, if you're a new hire and you think, man, I've been here for a month and I don't like this, do they offer that new hire and say, here across the street, we've got community corrections, or here down the road, we have the state penitentiary? Do they give them the opportunity to go to another correction facility?
Typically not in the first 6 months, they won't, but then after that, yes, they do. And that's not always followed, but it's hit and miss on each facility.
Okay, last question. You mentioned the county corrections. And I understand this is an arms race. The state raised to 28. They're going to raise to 28. All things being equal, does the state offer a better compensation package to employees than the counties do? Is that enough incentive to keep people working for the state corrections facilities versus Lancaster and Omaha?
So I would say Douglas County's total package, just because they have a pension plan, is significantly more. Of course, that's a lot more costly to the employer, but I'd say that they have a better overall plan. But as far as Sarpy and Lancaster County, I'd say our healthcare is better than theirs, and we have, to my knowledge, we have the same retirement plan. I think it all depends. It depends on what your style is. Some people, new staff, love the 12-hour shifts with what we call the Panama schedule, which is 4 on, 3 off, 3 on, 4 off. And that's how Sarpy County does it, and they really like that. And so you'll just get some people because of that, those scheduling things. Or they like working in a more secure environment. Counties are a lot more rigorous. They have a lot less programming, things of that nature. Some staff enjoy working in that environment instead of the prison environment, which has a lot more program, a lot more stuff going on.
Thank you.
Yeah.
Senator Geis.
Yes, thank you for your testimony. And I just have a question about the mental health that you were talking about for officers. Is there anything currently in their insurance program that provides mental health for your officers?
So right now you have EAP, and I'll be honest, no one really likes to use EAP. A good example is I had a staff member at one of my facilities after she lost her son use it, and it was 3 phone calls, and that was it. And that just isn't real acceptable for our crew. It's hard enough to get our guys to reach out because they're concerned about it getting reported their job. Because if someone reports that I'm having suicidal thoughts of that nature, we handle firearms, so that affects our career. And so there's a lot of concern about even bringing it up, so they just kind of pent it up. You'll hear that a lot in the law enforcement community just in general. And so as far as our regular health insurance, it's covered just like regular. So I mean, it's $35 on the wellness plan, and I think $50 on the regular plan each time you go. So if you're going weekly, I mean, it's going to be $200 or something. So, I mean, I guess to answer your question, we would like something a little more easily
accessible. I know there are some programs that are starting in the community. I know here in Lincoln, I know there's some in Omaha that are for first responders. Some of those are also include correctional officers, I think maybe in Douglas County. I know not yet in Lancaster, but they do a lot of community involvement to raise money to serve the mental health issues of people just like your officers. So
yeah, I'm all I'm looking for resources, and the more the better. I'm all for it. Whatever.
I'll get with you, connect you with
I
them.
appreciate that.
I just have a couple questions, Mike, by way of clarification. When you talk about the RTC and you're concerned that there are not enough posts, does the American Association of Corrections Officials or some group like that set standards for how many posts there should be in different environments?
I'm not
Is
fully-
this just something the director decides?
Yeah, so
or is
from
it
everything I've
standard?
seen, I'm sure the ACA has some form of standard. From everything I've seen, it's been changed so many times. We had the minimums change 3 times in 1 month at RTC. And so I'm going to say it has to be a central office decision, just because of how quickly it happens. It's obviously not a standard by the ACA. They don't move that quickly.
Does the ACA come through, if you know, does the ACA come through and certify the department every year?
I think it's every 2 or 3 years I could ask.
Okay. That's all right. Somebody's going to come through and
I think
realize
that
that
would come
there's
up, yeah.
insufficient posts, if that's actually the case.
Possibly, like I said, so, and I'm not necessarily talking about insufficient posts. We have posts that are just left empty. So they're posts, they're in the allotment to be allowed to fill up to, but they're not considered part of your minimum, your critical staffing. So it's not a matter of having assigned posts, it's a matter of us we're not allowing overtime or anything to fill those posts because we don't think that they're necessary.
Gotcha. Well, thanks for clarifying that. That's the only question I had. And I don't see any more. Thanks for being here today.
Yep.
Good afternoon. Welcome, Mr. Inspector General.
Good afternoon, Senator Lathrop and members of the Judiciary Committee. My name is Doug Kobernick, spelled Koebernick, and I'm the Inspector General of Corrections for the Nebraska Legislature.
Can you speak up just a little bit?
I'm following the example of
Apparently
Zach
someone in my
last week.
family is right that I don't hear very well.
Just so
I'm
soft
still in
spoken.
denial, and so I'm just going to ask you to speak up a little bit.
Yeah, I thought I would touch on a few issues today and then answer any questions that you have. A lot of what I was going to talk about has been discussed already by Senator Lathrop and the acting directors, Dr. Ryan and Mr. Chipman. So I'll kind of just skip through my notes here. But last week, Zach Pluhacek from our office came in and talked to you about the health staffing issues. And I thought he did a really good job. I think that he really highlighted the concerns that we had about that. One of the things, though, that I think is really important is that we can discuss how pay should be raised for those positions, for some of those positions, if not all, to meet what's happening in the community or maybe in health and human services. But when we did that survey and had half the people respond, what we found was that it's the culture that is really impacting people's decisions to leave. It's how they are treated by those above them, how they are respected by those above them. And we think that needs to be addressed as well. That's an issue that has been ongoing for 7 years, as during my time as Inspector General, that we've heard from security staff, health staff, constantly over this time period. And when you go back and look at the surveys that we did of security staff back in the day, they didn't talk about pay being the big factor to keep them around. It was how they were treated by those above them. And if we had done more on the front end to do that, I don't think that, I mean, we probably would have increased their pay significantly, but probably didn't need to do it like it happened. I think the same thing can be said for the healthcare staff as well. So I want to make sure and make that point. And yesterday I received a Department of Administrative Services vacancy report. They put one out every quarter, and I just provided it to you. And what you'll see there, and I was really surprised by it because I thought this number had probably gone down, but I like to look at the DAS report because it's a constant that comes out every 3 months, and we can see. And if you look at what I handed you, the total vacancies, if you go back to like 2016, for the department were about 252. And then over time, it kind of gradually crept up there. And I remember raising some concerns back in the 2021 when it got to 391 vacancies. And I was like, whoa, that's an all-time high and everything. Well, then it really escalated and went over 500. And the department has made some really significant strides in getting those security staff positions filled and everything. But at the end of the day, as of September 30th, just 2 weeks ago, we still have 377 vacancies in the Department of Corrections, according to the Department of Administrative Services. So I wanted to bring that to your attention because it shows that while there's progress and the line's going down, that's good, but we still have a ways to go. I don't want anybody to think that this problem has been solved 100% or anything like that. And what's really interesting about this report too is that it lists all the positions that are vacant, the date that they were vacated or created, because there are new positions in here too. So that accounts for some of those 377 positions that were added in the budget this past year. And then their rate of pay is also included in there. I think that's a really helpful report that I look forward to receiving from our fiscal office actually every 3 months. I was going to provide you with some updates on all those reports that you talked about, so I won't really go into that. Classification study is very important. I'm looking forward to that being completed. I wished it was done by now. It's not, so we just have to accept that, and hopefully we'll get a good work product and learn things in the spring of 2023 that will help with the legislature in making good decisions and the new administration. The program evaluation, I wish that was moving forward in a faster rate as well. The legislature provided them with $240,000 to do that. And that's something that back in 2016, they did do an initial evaluation. I thought it was done really well. It's supposed to be the first of a 3-phase report. That person who conducted that left, and at that time I reached out to the department and they indicated that they just weren't gonna go ahead and finish it. And we've been pushing that over and over, and finally in 2021 in our annual report, we really highlighted it. And as a result, the legislature took action this last year to have them contract with somebody outside. So we're encouraged by that. I think that's going to be really important because there are some clinical programs that really need some evaluation for sure. The one issue on the halfway back report, which I don't think is a halfway back report either, on those 96 community beds, is that the program statement said that the parole administration would be administering that transitional housing facility and running it and everything. When I received a copy of the report, I contacted parole and asked them, who they've been in contact with about that study, about that program statement. They were unaware that it was taking place and had been completed. Nobody had talked to them. So in this program statement that we now receive, that we spent a few $100,000 on, it says parole runs it, but parole was never involved in any of the discussions from what I was told by the parole administrator. So I'm not sure that really is a helpful program statement. The electronic health record system, we do have a lot of concerns about whether that's actually going to get done by 2025. If it does get done, I really don't think it's going to do what it needs to do. An electronic health record system lets you communicate with other EHRs. The way they have this one set up right now, they've admitted that it will not. It will take some time after that for them to actually connect up with the other EHRs. So if I'm an individual incarcerated and I go out and get knee surgery somewhere, they won't be able to, even when this is completed, they won't be able to send that information electronically to the Department of Corrections. And none of my medical records from the Department of Corrections can go there. They will hand things like disc or paper back and forth between those. And when I leave the prison system, they will hand me a disc with my medical records if I'd like them, and I will then hand them to whoever my provider is. It won't be connected up. And that's a real concern. And I think that if we reached out to the OCIO and asked them where they are at with the status of this development of this system, I think that they would probably tell us that it will not be done by 2025. Our office probably should reach out to them this week and ask them about that, because if it's not going to get done by 2025, we should really just stop it and get a system in that works. So I feel pretty strongly about that. That's something that we started raising back in 2016 as well. And then on the RTC, the 384 beds, that unit will open here soon. We will have a report out probably this afternoon or tomorrow for the public that talks about the opening of that report. We had several recommendations on how that should be opened up, how things should take place within that unit, including having more experienced staff working in that unit. We didn't have anything about the stab vest. I wish we would have. But we did have a recommendation about having body cameras on the individuals assigned to those units, because these are going to be very risky individuals that are in that unit. Down at Tecumseh in the 2C program, they actually do have body cameras and the stab vest, but the Director Frakes rejected our recommendation on having body cameras and having more experienced staff there. But we will have that out sometime later today or tomorrow. And then finally, I would say one thing for the legislature. In our annual report this year, we had a few different suggestions for the legislature. One of those was that there's statutory language right now that requires the department to provide strategic plans to the legislature. The law required plans through the biennium ending in 2021, as well as progress updates on the plans through 2021. The last plan that they issued was in 2018. I think that those plans can be very valuable. I think it is important that the legislature go in and amend that law to have them provide those strategic plans going forward, because it is very important to get that information from the department. In the past, 10, 15 years ago, they used to put out annual reports that had a lot more information in them. They don't do that anymore. And I think that these strategic plans, when they were done, were very helpful in providing us with some insight on where the department was going. And then I said finally once, but I wrote a few notes here based on things that you had asked already. When we look at programming, being more on the back end, the clinical programming on the back end, it's been stated today and in the past that there are studies that say that we shouldn't provide it on the front end. I've been on a 7-year journey to find those studies. I have not been able to find those. Director Frakes was never able to provide those to me. I've talked to clinicians and other people, and they say that they have never seen anything like that. And they believe that they should be providing that kind of program more on the front end. And I would hope that we would start to do that. And then, let's see here. One thing too about when Director Sabak Ryan talked about some of those innovative programs like the Home Builders Association, I just wanted to throw this out here. At Tecumseh, they are providing that class when they have enough staff to handle it and everything. And those guys are in there doing some construction work, wiring, framing, things like that. It's really good. And they really like the program. The last time we were down there was only a couple people in the class because of they hadn't quite figured out how to approve people to get into the class from different parts of the facility because they might have had some assault or some other event in their incarceration that was disqualifying them from the class. So our office thinks that if we're going to have this class, we should actually have it filled up with more people. And if you can't fill it up at Tecumseh, let's put it somewhere else. But we could envision this where these people learn this job skill at Tecumseh or the state penitentiary. Maybe they go to OCC and then maybe end up at the work ethic camp. And when we were out at the work ethic camp last, we had staff talk to us about why can't we have our incarcerated individuals build homes here, like low-income housing that can help the communities in Southwest Nebraska. And so that's a really good idea. And we said, there's this HBA thing at Tecumseh where they're learning some skills here. If you could learn some skills here, then go to the next place, and then you go there, and we could work with NIFA and other folks to create such a program and actually help communities, help guys have these job skills. And so when they go out to the community, then they're ready to roll. They get the work release. They have a job lined up and everything. So we can do a lot of different things like that. Springfield, South Dakota has a prison that does that. I've talked to some folks about going up there, and I think that might be a worthwhile visit to learn more about that. And I'll make sure and invite the Judiciary Committee when I do that. So I've said a lot. I'll answer any questions that you have. Thank you.
Senator Geis.
I do have one, and it's about electronic medical records. And I'm wondering, I used to be in pharmaceutical sales, so I went through a number of clinics and hospitals that were transferring their electronic medical records. And a lot of times, the clinic and the hospital couldn't talk to each other. And I'm wondering if that's just a symptom of a typical problem that's even in the private sector of electronic medical records speaking to each hospital, because not necessarily does each hospital even have the same server of records. So I wonder if that issue is going to be an issue no matter what system they implement.
I think if they use a outside vendor, from my understanding, those systems all now, because of technology, are able to talk more together than in the past. I think there were like silos before, but what I've been told by people who work in the field, and actually I have a meeting set up with an EHR person tomorrow to learn more about this, since it's kind of an emerging issue. I think what we're seeing is that more they can now talk better together and everything. I'll find out tomorrow. I'll let you know.
Yeah, I'd be interested to hear that, because that would be something that I didn't know, because it was a conflict early on when people were migrating over to electronic records. So, and then one other thing is about the body cams. Is that a common thing in other prisons that guards wear body cams?
I don't know about every system, but it's definitely something that's out there and used pretty frequently around the country.
Okay.
So it's not unusual. What's really interesting to me, and I've been pushing this body camera thing for a while and it's not just me, it's the staff members coming to me over the years talking about how they would like to have body cameras. Right now, we only have body cameras on some individuals at Tecumseh and at the state penitentiary. I think at a bare minimum, anybody who is an emergency responder, so some incident erupts at like the Omaha Correctional Center, somebody's classified as an emergency responder, they should have that body camera on them so that when they respond to this situation, then at least we have the body camera. Even inmates would prefer to have body cameras. Some of them would prefer not, but some would, because they can then say, well, watch the body camera, and you can hear most conversations on a body camera. What's been disturbing to me is at the Lincoln Correctional Center, where we had mental health units, where guys acted out over and over and over, and there's a lot of conflict because of that with staff and a lot of different events that took place. They've never had body cameras there, and I don't know why in those situations you wouldn't want to have body cameras. And
So currently, and I might have missed this in what you said, currently is it just the people who are in the most high-risk areas that have them now?
It just depends on the positions for each at the penitentiary in Tecumseh. But yeah, you're going to have, I believe you will have more body cameras down in like restrictive housing than in other units. Though recently I watched an event take place in restrictive housing, and like nobody had a body camera. So it's puzzling,
it's
but
more random.
I think it would be helpful. And it was staff that brought that to me too.
Okay, thank you.
Senator Brand.
Thank you, Chairman Lathrop. Thank you, Inspector General Copeland. We used to have a program that built houses at the state penitentiary until recently, because I know they built housing, and they built about 20 a year, and communities like Plymouth, where I'm from, could apply to purchase those, but there were such strict guidelines on they could only be used for low-income housing, and which was unfortunate because, and I'm not going to go into what the needs are here, but what happened to that program?
It was a pretty small program, and it was a private entity outside the department that ran it. And They received some state funding, and it all kind of happened at the beginning of my time as Inspector General, but I believe they had some management issues that ended up having that entity they just ended what they were doing. And so nobody stepped up and taken their place since then.
Is that a viable enough program that Cornhusker Industries could take it over?
I think they could. They definitely could. They are capable of a lot of things at Cornhusker State Industries. And I think that is something that they could work with other partners and develop and do a really good job at, for sure.
Because I would say when we toured OCC 3 or 4 years ago, and we took a tour of the facility and got over to like the sewing shop, the wood shop, and talked to the supervisors over there, I was just so impressed by the quality of work, and they will tell you that these individuals love working there because it gives them something to do. So I would say, given Nebraska's current shortage of available workers, particularly in the trades, that I would love to see us pursue this in any way, shape, or form for more plumbers, electricians, drywallers, truck drivers, anything of that nature that would work well with corrections. And I don't know how businesses in the state of Nebraska can communicate that to our corrections.
Yeah, I think it really, whoever the next director is, whether it's Director Sabat Ryan or whoever, I think that's something that they could really take and run with and reach out to different leaders in the business community and housing. Like I said, NIFA has gone up and visited that facility in South Dakota and knows all about what goes on there. They're very interested in it. So I think somebody could really take it and run with it. And the other thing is McCook has a couple hundred guys out there that are, for the most part, they're a little bored when they go out there. They have some non-clinical programs or little substance abuse programs to do, but they kind of sit out there and wait till they get their turn to go to community. They could use more things to work on, and it would be more of a destination for them because they know that if they went out there, they would get those job skills, and we probably could pay them a little bit more too.
I'm going to ask you the same question I asked Director Spock Ryan. What is your relationship with the OIG with corrections?
I think she said cordial. I'd say, okay, that's probably accurate. I think, to be honest, because I think one of the things I've done in my 7 years is be very honest when I get asked questions. It could definitely be improved. The last time I met with Director Frakes was July of 2021 because he didn't choose to meet with me to talk about things. When I first started, we met on a regular basis. And I was just at a conference last week out in Washington of the Association of Inspectors General. And we had inspectors general from federal agencies there. And they were talking about how they've actually worked more to build those communication contacts and to work with their departments earlier on when things are happening. And they're not giving up any authority or responsibility, but they think they've seen some positive efforts from that. I think that is something that sitting in on those sessions, I learned that that's maybe something I need to work on, that I need to reach out to the department a little bit more and try to reestablish that communication and those have some regular meetings with the leadership. So I plan to do that.
All right, thank you.
I don't see any other questions. Thanks for being here. We appreciate what you do. You're the eyes and ears, and from inside the department, we can all tour facilities, but having someone there that's talking to staff and talking to those people that are incarcerated is beneficial in making policy.
Thank you.
I
Thank
very
you.
much appreciate what you do. Anyone else here to testify on this resolution? Dr. Spahn?
I don't have anything to add unless you have specific questions for me.
Maybe if you would come forward, just a few.
Is this 395?
375, isn't it?
375.
Good morning. My name is Dr. Ryan Spahn, RyanSpohn, and I'm director at the Nebraska Center for Justice Research at the University of Nebraska Omaha. And we have contracts with the Department of Corrections to evaluate the vocational life skills program, the classification study that has been mentioned a number of times. My associate director, Dr. Zach Hamilton, is working on that project as well. I'm open to any questions.
Can you just tell us where we're at with those or how they're progressing?
Yes.
Or have we seen progress? And by the way, I can appreciate that you enter into contracts with the department. I'm not asking you to express any criticism of the department, but to provide us with sort of where are we at on those contracts?
Right. The classification study is just as everybody has described. The terminology we use is a no-cost extension. So the project has been extended, and that was due to delays in getting the data. And my understanding is that the CJI project was obviously very data intensive, and the Department of Corrections only has so many data staff, and they recently had turnover in that office as well. So all their staff were busy getting the data to CJI, and we had to wait on that. But during that time, we did conduct what we call the process evaluation, and that was the interviews of staff and visiting all the facilities. And the Department of Corrections does have that first portion of the project, the process evaluation, in their hands to look at. And we do have the data and are working on what would be the outcomes of the study.
And that's on the classification.
That's
When
on
do you
the
think that's going to be done?
I believe it will be March is what I'm told, early spring.
March of 2023.
And then the correctional programming tied to most recently LB 896. We do have a verbal email agreement. We're finalizing a statement of work on that project. Very excited about that. I think it will kind of be a game changer as far as just being a resource and being able to help have an outside pair of eyes look at this programming and what's working and what isn't. Particularly the implementation of the programming from the clinical side. These evidence-based programs have treatment models that have been developed, and so we want to look at fidelity to the models and what are we able to get done. A lot of that depends on staffing, both the security staffing to be able to move people around if a facility isn't on lockdown, but then you also need security staffing in most of these facilities to actually walk the people to the program and get the people there. And then the discussion of having the clinical staff to deliver the programming, all of that has an impact on the ability of these programs to be delivered with fidelity, and then that impacts the outcomes. So we're very excited to be looking at that. We just need to go back and we have to form the legal contracts and things between the university and the Department of Corrections. And all of that is, as everybody said, is moving forward, and we're very positive about that.
One of the things you're going to look at, if I'm remembering this correctly, is the timing of programming as well. Whether it's more effective done early or near an individual's departure from the department.
To the extent that information is in the literature, we'll look at that. And part of that is the two projects aren't mutually exclusive. So the classification study, are we getting individuals at the right place at the right time where programming is being delivered and at a time in their window that it's not holding them back from being paroled, things of that nature. So is the individual where they need to be to get the programming, right time, right facility, and there's the staffing to deliver that program. So that's kind of where the classification study comes in to kind of streamline that process to make sure, individuals this part of their sentence are getting where they need to be to get the programming. And then the evaluation of the programming then is, is it being delivered with fidelity? Is it being delivered at the right time if there is research? And that's going to vary across programs. So we can't say all clinical programs should happen at the beginning of a sentence or at the end of a sentence, or non-clinical should be delivered. That can depend on the program, or there just isn't evidence, and we can be an entity that helps build that evidence on. It seems to work better when people get it earlier or later, things of that nature.
Okay. When do you expect that report to be completed?
The correctional evaluation report,
That
will be ongoing. So I believe LB 896 writes that we would evaluate 7 non-clinical and 6 clinical programs each year. So each of those evaluations would be separate entities, and they would have an evaluation report. So each year we would be handing over evaluation reports on individual programs that we're evaluating, and that is just an ongoing process.
Is that one program at a time? Like each year we'll see one program evaluated, or will you do 6 each year?
It'd be 13 each year, 7 non-clinical and 6 clinical is how it's written in LB. And it's a big endeavor, very big endeavor. But there's no this evaluation will take exactly a year. Some of these programs are larger, some of them are smaller, some of them are in multiple facilities, some are in one facility. So there's just going to be a lot of variety in what those evaluations look like.
And when do you think we'll see the first set of evaluations?
If we get the full evaluation process started, I'm hopeful for January. We'll need to hire some people to get this done. January of 2023, if that's when we started, maybe this time in 2023, we might have some evaluations completed.
So, all right, that's all the questions I had. I don't see any others. Thanks for what you do and the information that you provide this committee and the department to help them run well and improve in their mission.
Thank you.
Thanks for being here today, too. Anyone else have any testimony? Okay, I see no other individuals coming forward. I don't have a big close. I think this has been a useful undertaking so that we can, as a committee, talk about some of the issues that to me feel like they have not been resolved. And to the extent it informs what might be worked on in the next session or with the next administration. That was our purpose today. I appreciate the testimony of those who appeared here. And there is much work to do. It's a big organization with a lot of challenges and a lot of ground to make up. And hopefully we've shown a light on some of the things that need some attention. With that, we'll close our hearing on LR 375. And that's our last hearing of the year.
Thank you, Chairman.
Thank you, Chairman.
Thank you.